So the GESA guidelines talk heavily of assessment for eating disorders for people with idiopathic gastroparesis, discouraging assessment of specific medical conditions that could cause gastroparesis, such as those in Statement 8, and simultaneously doctors are disregarding how medical evidence of non-idiopathic gastroparesis in favour of eating disorder diagnoses, and patients are being forced to access life-saving medical and surgical care overseas because of how far behind the evidence base Australia is and how severely misdiagnosis like this impacts access to appropriate medical care. Forced feeding practices used on ED patients are barbaric, even when the patient genuinely has an ED, but the severity of trauma significantly compounds when it's a misdiagnosis. When people are misdiagnosed with an ED, they don't receive testing or treatment for their actual medical conditions, and legislation like the Mental Health Act is used to enforce treatment for the ED. This legislation is state-based. However, this is a nationwide issue. The Mental Health Act allows doctors to enforce treatment with the malnutrition and weight loss the patient experiences considered a behaviour the patient once chose that is now simply out of control. Coercion, threats of physical force, and direct use of physical force are used to elicit changed behaviour from the patient until the patient's weight is deemed safe and healthy. Once an eating disorder label has been applied, all gastrointestinal symptoms are attributed to it, regardless of the evidence to the contrary. This means patients whose gastrointestinal systems do not work properly are violently forced to consume food and fluids their bodies cannot properly process. This results in severe pain, swelling, organ damage including prolapse, extreme psychological distress, and medical trauma. That impacts how patients are able to access care in the future and the way doctors interpret their distress in that setting. This is not hyperbolic. This is what patients report experiencing, and healthcare professionals who believe us apologise for on behalf of their colleagues who engaged in this behaviour. Patients do report this misconduct, as sometimes the doctors and nurses engaging in it actually know exactly what they're doing. They know the patient had a genuine anatomical cause of malnutrition, but still force oral or nasogastric feeding beyond what the person's body can tolerate. Unfortunately, oversight bodies like the Office of the Health Ombudsman clear hospitals and their staff of all wrongdoing without assessing the evidence provided by the patient or their support persons. I know this because I was told it directly by the oversight body. When systems of accountability are failing and guidelines like these GESA guidelines for idiopathic gastroparesis are enforced, the harms compound, resulting in higher levels of disability, death, and cost blowouts for the health services. Technically, it is very expensive to hold a patient under the Mental Health Act for refeeding, especially if their issue is anatomical, as they're pretty much guaranteed to continue having the same issues maintaining nutrition status and weight. In my last video, I gave 2 actions that you could take, but what I'm going to say here is specifically for health and allied health workers. When your ED patient tells you they have a gastrointestinal condition and cannot tolerate the food or feed, don't dismiss it as a psychological symptom. Don't dismiss them as a liar. Remember, malnutrition always causes psychological change. The anxiety, obsessive-compulsive behavior, depression, insomnia, and even trauma symptoms are more severe for every human being alive when malnourished. What you are seeing in front of you is from the malnourishment, not an eating disorder. Listen to what your patient reports to you about their own body. They are the expert in their own bodies, just as you are the expert of your own body. You hold specific knowledge that can help your patient understand their physical symptom pathology. Share your knowledge with the patient and document clearly the physical nature of the symptoms and need for investigation that isn't based in psychiatry or psychology. Please pay attention to which of your colleagues are baiting patients, because they do. Which of your colleagues are using restrictive practices and what the patient tells you actually happened. Whether you want to believe it or not, some of your colleagues are instigators and are trying to elicit reactions from patients so that they can use force on them. And please remember that when I say all of this, and other people like me say things like this, We are not trying to destroy our healthcare systems or make money. We just want our healthcare services to be safe for everybody, and your colleagues that engage in this behavior are making your workplace less safe for everybody, including you. It's just that the patient cops the blame. Thanks.